Next question. We're the only country that allows health insurance companies to operate, pardon me, as for-profit businesses. What value does that bring to the health system? Dan Krajnovich, I'll let you answer that one.
Dan is a nice guy before he answers the question.
Well, you know, again, I think it comes back to some of the things we've been discussing here, which is, you know, in the medical field, obviously, back to paying doctors well. You know, this is a very complex industry, one that requires a lot of talent, one that, quite frankly, I think this country, if there's one aspect that we are proud of, is that we do have probably the most talented healthcare individuals in the world residing in this country. And quite honestly, on the healthcare insurance side as well, you know, again, it's a complicated system, and we certainly have very talented individuals working on that end. Back to Dr. Brater's point, you know, it's not a perfect system out there today, and we all realize that, and we need to fix the system. Quite honestly, I was with my barber yesterday, and he said something very, very revealing to me, and that is, he doesn't think anything's going to happen. And he, quite frankly, is disgusted with the whole process of what's happening right now in D.C. and what's happening across the country. And he's given up. He said nothing's going to happen. And quite frankly, I think that would be the biggest tragedy of all if we end up going into next year with no health care reform. We've supported it from the beginning. We need to cover all Americans. We need to look at ways that we can eliminate pre-existing condition limitations. We need to look at ways that we can provide coverage without rating people on their health care status and or their gender. And we need to look at how we can bring everyone into the system in a way that we don't disadvantage low and moderate income families. And we need to open this system up, the best system in the world, to every American.
Could I again, a brief comment? We keep hearing this stuff that we've got the best health system in the world. The data show that if you look at outcomes, measures of outcomes, that we are at best average in the industrialized world in terms of our outcomes. And the data also show that our costs for average outcomes are much, much higher. So this whole notion that we've got the best health system in the world, I'd like for somebody to show me some data that even suggests that that's true.